Hi, my name is Dean. I'll be doing a presentation on scenario 1 in regards to the SBAR. But before I start the actual SBAR, I'll do an introduction. In busy settings, healthcare teams may lack time to create comprehensive and detailed patient documentation and handover reports. The Situation Background Assessment Recommendation, or SBAR for short, is a communication framework used by nurses to promote continuity of patient care and enhance patient-centered communication. The SBAR framework is used during patient handover between nurses to communicate with doctors and other healthcare teams, and to also seek clarification about the management of patients. In the first case scenario that I'm going to be presenting, Mr. O is a patient who presented with complaints of dizziness and lightheadedness. He is admitted at 1600 hours with stable vital signs, and he is handed over to the next nursing shift at 1900 hours. His condition deteriorates, and by 21:30 hours, his vital signs are cause of concern for the nurse. Now, I'm going to develop the SBAR, which is a situation, the background, assessment, and recommendation framework that the nurse can use to present the problem, important information, assessment, and make action requests from the physician. Additionally, I'm going to present a reflection of the SBAR simulation as well. So I'm going to do scenario 1, the situation. Hello, I'm Ben. I'm a registered nurse calling from the acute medical unit. I am calling in regards to your patient, Mr. O. I am calling because I am concerned about the patient's distended abdomen, large black tarry stool, abdominal pain, and low blood pressure. Background: the patient is a 63-year-old male who came to the AMU and accompanied by his wife. His main complaints were lightheadedness, dizziness, and syncope. The patient, Mr. O, has been hospitalized before for an acute myocardial infarction and chronic heart failure. Mr. O is currently taking pain medications for chronic back pain. Since his admission at 1600 hours, Mr. O blood pressure has dropped significantly from 138 over 84 to 94 over 66. His pulse has increased from 76 to 104, and his respiratory rate has increased from 16 to 24. My assessment is that Mr. O may have gastrointestinal bleeding, as evidenced by large black and tarry stool, abdominal pain, distension, drop in blood pressure, and increase in pulse and respiratory rates. The GI bleeding may be side effect of prolonged use of the pain medication he has been taking for his chronic back pain. I recommend that you should come as soon as possible and evaluate the condition of Mr. O because he is deteriorating. But before that, there any diagnostic imaging tests you would like me to order before you arrive? In my opinion, we should conduct fecal occult blood tests and hemoglobin and hematocrit blood tests to evaluate the extent of hemorrhage. I do think we should also keep him on NG tube as needed, as needed status to allow his gut and stomach lining to rest and prepare him for an additional diagnostic procedures. We should also administer IV fluids and observe him for signs of hypovolemic shock. So now, what were your thoughts on the clinical scenario? I think that this clinical scenario was an excellent opportunity for me to learn and practice using the SBAR module as a communication tool. I was able to practice using SBAR in clinical handover situations and communicating to others member of the healthcare team about Mr. O's status as well. Using the using the SBAR module is in this clinical scenario also promoted clinical judgment by critically analyzing Mr. O's situation, his background, and assessment. I was able to establish a nursing diagnosis and make clinical recommendations. For example, Mr. O's background information about a distant abdomen, large black tarry stool, and dropping blood pressure made me develop an assessment that Mr. O is at risk of bleeding. Based on this, I recommend that the patient should be put on IV while waiting diagnostic results. What do I think could have been added to the SBAR? I think the SBAR should have added information about the medication given to the patient in his earlier hospitalization for acute MI and chronic heart failures. The SBAR should have also included information about Mr. O's cognitive, social, and emotional background. What do I think we did not need in the SBAR? I needed all elements of the SBAR to prepare me for the case scenario. All the information helped me to know the information I need to look for in the patient charts and orders. If we did this conversation again, what should we do differently? If I were to hold the conversation again, honestly, I will utilize Mr. O's chart to find out the previous dates of hospitalization and medication use. I will also discuss Mr. O's IV solution, location, and rates of administration. Do I think the significance of situation was clearly presented to the physician? Of course, yes. I think the seriousness of the matter was clearly communicated to the physician. The concern about Mr. O's deteriorating health was mentioned in the situation and recommendation section of the SBAR. Additionally, the nurse expresses the urgency of the matter when he requires the clinician to assess the patient as soon as possible. So now, in conclusion, or let me summarize this. Communication among healthcare teams during the care of patients is crucial in reducing errors, preventing sentinel events, and enhancing patient outcomes. The SBAR tool is an easy and effective method of ensuring proper communication within healthcare teams. Nurses should be able to use the SBAR framework to frame patient conversations and address critical concerns that require immediate attention from clinicians. My name is Dean. That's my video presentation of the SBAR. Thank you very much.